So now we're gonna look at the red flags and just treatment in general for COPD. So oftentimes COPD is not detected until it is very, very advanced, because people tend to attribute like the symptoms that come with COPD for just becoming old. So this is like breathing difficulty and shortness of breath. That's just a common thing. It's like, oh yeah, I'm becoming older, I'm becoming tired. That's a common justification. And then especially if you are a smoker and you've been smoking for a prolonged period of time, you could have like the smoker's cough and the wheezing, and that's something that's like, oh yeah, that's something I kind of always been doing. But then you start being like, you have less energy, so you can't partake in as many activities. And that's because just the quality of your lungs, like your lungs are such an important part of our bodies because it brings the oxygen from outside inside into our lungs diffuse it from a gas into our bloodstream. But in case that process is being compromised, that oxygen that would actually bring like some life into our body is like being compromised. So once upon a time when you were able to do 10 things, you can barely do 5. So major key is always to double check as a medical profession and just like really be sure about the diagnosis that you provide patients, because these conditions, they can be treated. Sadly enough, COPD is not curable. However, there are treatment options such as medication, oxygen therapy, pulmonary rehabilitation, and social support groups that allow these parties to live with the disease for many years, so you can still have a quality life with COPD despite the shortcomings that come with it. So, on to the next slide.